Apple cider vinegar has become a staple in many health-conscious households. Its popularity stems from a long list of purported benefits, from aiding digestion to supporting metabolism. While many people take ACV in the morning, a growing trend involves consuming it right before heading to bed. This specific timing is thought by some to offer unique advantages. But is drinking ACV before sleep truly beneficial, or does it come with potential drawbacks? Let's explore what the science and anecdotal evidence suggest about this nighttime practice. We'll break down the potential effects, both positive and negative, and discuss how to approach this trend safely if you're considering it. Understanding the potential impacts is key to making an informed decision for your own health routine. One of the most discussed potential benefits relates to blood sugar levels. Some research suggests that consuming ACV can help improve insulin sensitivity and lower blood sugar responses after meals. Taking ACV before bed might help moderate the natural rise and fall of blood sugar that occurs overnight. This could be particularly interesting for individuals looking to support stable glucose levels. For some, this stability might contribute to better sleep quality, avoiding potential awakenings caused by blood sugar fluctuations. However, this link is often anecdotal and requires more robust research. ACV is also known for its potential role in digestive health. The acetic acid it contains is believed by some to stimulate digestion and improve nutrient absorption. While often taken before meals for this purpose, some proponents suggest that a small amount before bed could help regulate overnight digestion. This might be helpful for those who experience digestive discomfort. Another area of interest is weight management. While not a magic bullet, ACV's potential effects on blood sugar and satiety might indirectly support weight goals. Some studies indicate that ACV can increase feelings of fullness, which could theoretically reduce late-night snacking. However, the impact of a small amount before bed on overall calorie intake is likely minimal. The idea is that by potentially influencing metabolism and blood sugar, ACV could create a more favorable environment for the body overnight. But these effects are often subtle and part of a larger healthy lifestyle. Some people report feeling more rested after incorporating ACV into their bedtime routine. This could be linked to improved blood sugar control or simply a placebo effect. It's important to remember that much of the evidence for these specific nighttime benefits is preliminary or based on individual experiences. More large-scale studies are needed to confirm these effects. Despite the potential benefits, drinking ACV before bed is not without its risks, primarily due to its high acidity. The most significant concern is the potential damage to tooth enamel. Consuming acidic substances right before sleep means the acid can sit on your teeth for hours. This can erode the protective enamel layer, increasing sensitivity and the risk of cavities. Another common issue is digestive upset. For some people, the acidity of ACV can trigger or worsen acid reflux and heartburn, especially when lying down shortly after consumption. This can lead to discomfort, a burning sensation in the chest, and potentially disrupt sleep rather than improve it. Individuals prone to GERD or indigestion should be particularly cautious. ACV can also interact with certain medications. For example, it might affect blood sugar levels, potentially interfering with diabetes medications. It could also impact potassium levels, which is a concern for those taking diuretics or other medications that affect potassium. Always consult your doctor if you are on medication. Drinking undiluted ACV is highly discouraged at any time, but especially before bed. Its strong acidity can irritate the esophagus and stomach lining. Over time, consistent exposure to undiluted ACV can lead to more serious digestive issues. Dilution is absolutely essential to mitigate these risks. The potential downsides highlight the need for caution and awareness. While some may tolerate it well, others might experience significant discomfort or health issues. If you decide to try drinking ACV before bed, safety should be your top priority. The most crucial step is proper dilution. Mix 1 to 2 tablespoons of raw, unfiltered apple cider vinegar with at least 8 ounces of water. Never drink it straight. Consuming it through a straw can help minimize contact with your tooth enamel. This provides an extra layer of protection against acid erosion. After drinking the mixture, Rinse your mouth thoroughly with plain water. Do not brush your teeth immediately, as brushing acidic weakened enamel can cause more damage. Wait at least 30 minutes. Consider taking it a bit earlier in the evening, perhaps 30 minutes to an hour before lying down. This can give your digestive system time to process it and potentially reduce the risk of reflux. Start with a very small amount, like 1 teaspoon diluted in water, to see how your body reacts. Gradually increase the amount if you tolerate it well. Pay close attention to how you feel. Note any changes in digestion, sleep, or dental sensitivity. Your body's response is the best indicator of whether this practice is suitable for you. Consistency is often mentioned for seeing potential benefits, but listen to your body first. If you experience negative effects, stop the practice. Remember that ACV is a supplement, not a cure-all. It should complement a healthy diet and lifestyle, not replace them. Certain individuals should be particularly cautious or avoid drinking ACV before bed altogether. This includes people with a history of acid reflux, GERD, or ulcers. Those with diabetes should consult their doctor before using ACV regularly, especially if taking medication to manage blood sugar. ACV can affect glucose levels. Individuals with kidney disease should also seek medical advice, as ACV can influence electrolyte balance. Anyone taking medications for blood pressure, heart conditions, or diuretics should discuss potential interactions with their healthcare provider. Pregnant or breastfeeding women should also consult their doctor before adding ACV to their routine. If you have sensitive teeth or existing dental issues, the acidic nature of ACV could exacerbate these problems. Discuss it with your dentist. Essentially, if you have any underlying health condition or are taking prescription medications, getting professional medical advice is non-negotiable before starting a nighttime ACV routine. So, what's the final word on drinking ACV before bed? The potential benefits, particularly regarding blood sugar, are intriguing but not definitively proven for nighttime consumption in large studies. Anecdotal evidence suggests some people find it helpful for digestion or sleep, but this varies greatly from person to person. The risks, especially to dental health and potential digestive upset, are significant and well documented. These risks are amplified when consuming acidic substances before lying down for several hours. For many, the potential downsides may outweigh the unproven benefits of this specific timing. There are often safer and more effective ways to address concerns like blood sugar or digestion. If you choose to try it, strict adherence to safety guidelines like dilution, rinsing, and timing is crucial to minimize harm. Drinking apple cider vinegar before bed is a trend with some theoretical benefits but also clear potential risks. It's not a miracle solution and certainly not suitable for everyone. Always prioritize safety by properly diluting ACV and protecting your dental enamel. Listen carefully to your body's signals and discontinue use if you experience any adverse effects. Before making any significant changes to your health routine, especially if you have existing conditions or take medications, consult with a healthcare professional. They can provide personalized advice based on your individual health needs. Ultimately, whether or not you incorporate ACV into your bedtime routine is a personal choice. Weigh the potential pros and cons carefully and make an informed decision that supports your overall well-being.